Hi, case of the day, and we have a new Monday to start with. And today it's a little later than usual because I got bogged down with some of the literature, and you'll see that in a minute. So, this is case 68 titled CT guided biopsy of a suspected hepatocellular carcinoma issues and indications. So, the 62-year-old man was referred for a CT guided biopsy of a segment 8 lesion on a PET. Uh, this was about a month ago, and there's this ill-defined lesion in segment 8. There seems to be a tumor thrombus. The liver is cirrhotic. There is portal hypertension with collaterals. The initial referral was for a USG guided biopsy, but my colleague was not able to see the lesion well enough. So a CT um, guided biopsy was scheduled, and as is the norm, I did a multiphasic or a triphasic CT before the biopsy. And you can see this non-rim arterially enhancing lesion, and this seems to be contiguous into the tumor thrombus. And these are findings that we would typically say represent an LR-5 observation and perhaps may not need a biopsy. So I took a little more detailed history then, and then later on spoke to the oncologist who had sent the patient to understand a little more. So the AFP level was borderline, but more importantly, this patient was scheduled for a liver transplant for the chronic liver disease about 7 months ago. And then it got derailed because of financial constraints. And now we're not quite sure what the issue was and whether the segment 8 lesion had been picked up or not, etc. So, anyway, did a biopsy using an 18 gauge bar 20 millimeter throw with a 4-degree cordocranial because I wanted to make sure I got in using this window so that I didn't puncture the lungs. And here it is. Went in. There was a little bit of ascites, and that was fine. Did the biopsy, came out, and it took about 5-6 days for the report to come, which came this evening. And hence, I'm doing this case. And there's another reason why I'm doing the case, and it's a combined HCC cholangiocarcinoma, so it was worth doing the biopsy. Now, there is always a lot of controversy about performing biopsies in patients with suspected HCCs, but this is a paper I read this morning. In fact, the notification from PubMed came last evening, and Akshay Baheti was kind enough to get me this paper. Um, and it's a badly written paper. It could have been better edited and reviewed. But ChatGPT helped me get the recommendations in, and these are based on society classifications. And this is what it basically says, that in all of these situations, a biopsy is indicated. And then ChatGPT was able to give me this chart. So LR-TIV is what our patient had, and a biopsy is indicated in that patient, and so this was right to do. And another indication that the paper mentions is subtyping and molecular classification, and that is an indication that has been increasing in the last 3 to 4 years. So on and off, I think once in a couple of months. Earlier, it was once in 6 months. We get a patient where the patient is a known HCC, but material is needed for molecular typing. Now, the patient did bleed, and you can see that in the last image of that set that I showed, where there is increased density within the ascites. And so I put the patient in the right lateral decubitus position, and this is just simple mechanical compression which worked, and there was no bleeding after this. And an hour later, and the patient was absolutely fine, so patient went home. And I remember about a month ago I'd read this paper that had also come out just then about complications of image guided liver biopsies from a large cohort in Germany. And again, not a very well written paper, but I could distill this, 12,000 plus patients, very low complication rate. I mean, rate of any complication was 2%. Bleeding was 1.4%, 3 fatal cases, 3 deaths, that's 0.02%. And pneumothorax was 0.2%, but with technique you can actually avoid this. So what caused bleeding? One was thrombocytopenia. So apparently INR and APTT did not make a difference, but medico-legally, we should make sure that the INR is under 1.5, but checking platelets actually makes a difference in patients who have chronic liver disease, and it's a good idea not to biopsy under 100,000 for sure, and under 150,000 perhaps, based on this paper. CT guided biopsy was a risk factor compared to ultrasound guided, but that may be technique related, absence of CT fluoroscopy, etc. And segments 7 and 8, not 6, had higher risk, and that's probably because of where they are. And 8, especially because you do have to angulate, chances are you might go through lung and cause a pneumothorax, etc. So there are specific indications for doing a biopsy in patients with suspected or known HCC. This is in summary. And the procedure is really safe as long as the platelets are adequate. My WhatsApp channel, and thank you.